You know, sometimes you go to the dentist and it's just a tooth cleaning, and sometimes it's a root canal or a dental implant. And that's what we're here to talk about today. Let's compare, contrast, fill us in about what goes on in the world of root canals and dental implants.
Yeah, so we see this every day. All right, so I'm smiling because patient will walk in for cleaning, we take their normal x-rays, and then we see something on an x-ray, we take another x-ray, and we'll use you as the patient. Randy, you know, is this tooth hurting? No problem. So you see that black hole on the end of that root tip? Or yeah, I do.
Yeah,
and it doesn't hurt you? Okay. Well, let me just talk to you. Can I have permission to tell you a little bit about this? Well, that's an infection.
Okay.
And then we measure the infection, and it's pretty big. It's like more than 5 to 6 millimeters, which is usually not such a good outcome. The likelihood of that being in your mouth later in life is probably not good. All right. So my license in the state of Ohio, I have to tell you about root canals, and I have to tell you about other alternatives. We can do a bridge, we can do dental implants. What I really recommend typically is if a tooth has a small infection or a lesion is what we're talking about,
okay,
we'll talk about root canals, because I do root canals. Okay. If it's larger than that, then we'll start talking about removal of the tooth and placing an implant. If it makes sense to do it at that time, or
okay,
take the tooth out and let it heal and then put an implant in later. But in the simple conversation, like, when do we do this? When do we don't do that? A lot of factors. Some people feel that root canals are unhealthy. And in some cases, I agree. All right. Some people don't want metal in their mouths, which what an implant would entail.
Sure.
However, there's zirconia implants.
Oh, okay. There's no metal?
No metal.
Oh,
It's ceramic. So that's another topic. What it comes down to, I think, it's what the patient goal is, what they're willing to go through to have that. Both procedures do sound scary, let's be honest.
Oh yeah, they do. I've had a root canal done before, and I know what that's like. And
it's different.
No, thank you, ma'am.
It's different nowadays. We have some, I call it GPS system. It's not a GPS system, but it tells me where to travel to take care of the root canal. And then we have the same thing robotically with dental implants. So whatever is best for you, that makes most sense,
okay,
is where we kind of go. Now, I'm going to recommend what I feel is best for you. I'm going to treat you as my brother, my cousin. What would I do for you? This is my recommendation. And you say, that's great, doctor. I think this makes the most sense. We do both procedures. There are specialty people that do implants and specialty people that do root canals.
Mm-hmm.
They're great too. The perspective usually, I think, within both groups, to be fair, even if they don't do root canals, and they see a tooth that's a root canal, my trust in my profession is they would say, yeah, you need a root canal, or vice versa.
Yeah.
So,
and is part of the essence, root canals, like, you think you can save the tooth yet, and dental implants, like, like that tooth is too far gone, or it's going to give you trouble down the road. I'd recommend.
Well, see, that's the
take care of it
trouble
now
with dentistry. And I mean, I've been in the business long enough. I know what happens.
Yeah.
I'm trying to be heroic and do you a favor by doing a root canal and put a post on and a crown, and then it's an expense, and maybe you weren't feeling that great for the entire time, which we've had, I gotta be honest. But it looked like at that time that was the best option. So now we stop, and because I have the experience of storytelling, I can tell you, Randy, I think, in this situation, this reminds me of John's situation.
Yeah, right. You've got perspective because you've done this for so long.
Right, I mean, like that commercial, what is it? Farmers Insurance,
Let me tell you this story.
Yeah, we know a few things, and we've seen a few things.
Right, okay.
And that's kind of really what has happened. And the reality is, the stuff that dentistry is made to do, and let's face it, the statistical data is root canal and a crown, maybe 5 to 10 years length. Now, I've been doing this a long time. I have teeth that have been in for over 30 years with these procedures. I also done procedures, root canals, post and crowns, that the tooth didn't make it a year.
Okay.
So is it my lack of judgment on no, it's more like this is what it looks like at the time.
Yep.
And I don't know what happened from the time you left after we completed it. I take ownership on anything that I feel that we could have done better, which can happen. And the most part, I think we're hitting the mark. I think we're hitting the mark on what we're trying to do. But it all starts with this conversation.
Yeah.
Randy, what do you think is best for you?
Yeah.
And if you say, I think the root canal, doc, I just can't see pulling a tooth and putting this piece of metal or glass in my jaw. It does not compute. All right, Randy, this is what we're going to do. This is going to be maybe a 5-year fix. But are you going to be okay with me if you come back in like 6 months to a year? Or I can say, look, why don't we just do it this way? Let's go to the specialty person. Let them make the decision.
Okay.
They can do the root canal. You come back, I'll put the tooth on it. Or if they say, no, Dr. Bilski, maybe on the right track on this one, why don't you get that tooth taken out? And I think that makes people, it's more real.
Yeah, well, I'd say it's straightforward.
Yeah.
That's all you can ask for from anybody in terms of getting their opinion.
And we're just trying to, we are really trying to help.
And I'd want that,
It's my business, but I'm trying to help you. Like, I don't need to upset you. I want you to have success. I want you to send people to me. So.
Yeah, if you don't have success, you're not going to recommend folks, and that's why wouldn't you?
For sure.
Well, thanks for sharing this, because again, I'm probably dumber than anybody who's watching this about this stuff, and I really didn't understand what a root canal, where a dental comes in, but it's and the conversation sounds very important too. So if I think I need a root canal, why say family? So I don't want that again.
Like they tell us in dental school, inform before you perform, and
Perfect.
It gets you a lot of places quickly.
Inform before you perform. We're going to end on that because that's the appropriate way. Hey, thanks for watching.